Start.
PID Sangeeta, it's over to you.
Welcome to this webinar. Eastern India Lions Leadership Academy, in its webinar series, is now presenting today Lions engagement with diabetes programs in India. Lions, as you know, has taken diabetes as its core program in this new century of service. Today we have speakers, Dr. Sanjeev Indurkar, who's a diabetologist, our very own international director, Dr. Naval Malu, who, being a practitioner, is going to be speaking how the Lions can really involve themselves in diabetes programs. And then we have LCIF trustee, past international director Vijay Raju, who is going to be a speaker and who's going to tell us how we can get support from our foundation. But before we go on to the webinar, I would request past international director AP Singh to tell us something about the Eastern India Lions Leadership Academy and its activities. Over to PID Singh.
Thank you, PID Sangeeta. Many of you would be aware that we started Eastern India Lions Leadership Academy to build a platform for conversations between the lions of the world. We started with webinars, video conferencings, and our website has various kind of data and resources available which the lions from all parts of the world can use. There is training material, there is research data, there are videos of some very important recordings and interviews, and there is a whole lot of other stuff that we can use. And all this material has been provided by Lions. So basically, this is an academy for us, run by us. This series of webinars that we've been running, we've usually had webinars which are not specific to any constitutional area. But while we were speaking amongst ourselves, and more specifically with ID Naval Malu and trustee and PID Vijay Raju, we felt that it would be very appropriate to discuss about how Lions could engage with the diabetes programs, and that's how we spoke about this webinar. We have a couple of friends in our attendees list today who are joining us from other parts of the world. But more or less, this is going to be a discussion about the possible diabetes programs in India, but then a lot of them could be even replicated in other parts of the world, because after all, the service programs and service projects are more or less of a similar nature, but they have some typical matters related to the local areas where the Lions run them. So I hand it back to you, PID Sangeeta, for starting this webinar, and let's see how the discussions go. We'll first have the three presenters speaking to us, and then we will throw open the discussions to all the attendees to ask questions, and they could specify to whom those questions are aimed at, and the panelists will then respond to their queries. If you want to ask questions at that point of time, please put up your hand by clicking on the hand button that appears on your screen. Over to you, PID Sangeeta.
Thank you very much, PID AP. And now we'll move on to the webinar without much ado. Lions engagement with diabetes programs in India. What is diabetes? How does it impact? Let us hear from an expert diabetologist, Dr. Sanjeev Indurkar from... And over to Dr. Sanjeev Indurkar. Dr. Indurkar.
Start.
Dr. Sanjeev Indurkar from Aurangabad.
Yeah.
Would you please
Yes.
come online?
Good evening, everybody. Dear Lions, friends who are at this meeting. the magnitude of diabetes mellitus.
Slide, slide. दाखवायची ना slide पाहिजे ना त्यांना. ठीक आहे. त्यांना पुस्तक
What is diabetes? How common is the problem of diabetes? And where we stand as far as diabetes in India and globally is concerned. Here, when
I'm very sorry that I've had to mute Dr. Indurkar, and maybe we'll go back to him later on. So, PID Sangeeta, till then, I think we have to move on to PID Vijay Raju, because the sound quality that we are receiving from ID Vijay Malu, ID Naval Malu, and ID and Dr. Indurkar, we cannot work there.
I think they need to keep their mobile phones away from the microphone.
So we are moving on to the part of the presentation, and which was for PID Vijay Raju, and we will have PID Vijay Raju can start his part of the discussions right now. I am unmuting PID Vijay Raju.
Past Director AP Singh, Past Director Sangeeta, and other distinguished panelists on this webinar and attendees. Welcome to this wonderful initiative of Eastern India Leadership Academy. I'm extremely pleased to share some of the facts and information from the Lions Clubs International Foundation perspective. Lions Clubs International Foundation, through its Board of Trustees in the year 2017, have initiated a very special program to support Lions, districts, and the multiples for the diabetes applications process.
And I will give you the speaking options, and you will have to go on.
AP, we can hear your voice. AP, we can hear your voice.
Can we go ahead? Lions Clubs International initiated a new department called Global Health Initiative Division. This particular division, earlier they used to only look after the Site First related programs, but now they've been given a task to handle the diabetes applications as well. It'll go like this. The system is thrice a year, the diabetes programs will be considered, applications will be considered for the support as a grant. The applications can be made by districts, multiples, and some of the large clubs as well. What's important here is the application should reach Lions Clubs International at least 90 days ahead of the scheduled period. What's important is the objective of this particular grant support is we are, as LCIF, willing to support up to $250,000 US for a multiple. If it is a sub-district's application, we encourage up to 2 applications up to an amount of $150,000. The vision of the Lions Clubs International Foundation is reduce the prevalence of diabetes and improve the quality of life for those diagnosed. This is the approach of every Lions Club, district, or a multiple world over. We have set certain goals. Most importantly, the support can be from educate Lions and their communities about diabetes and pre-diabetes. The second goal is to develop community environments that inspire and support healthy lifestyles. The third goal to support diabetes is increase access to diabetes care, medication, and diagnostic equipment. The fourth goal, increase coordination and support in the implementation of national diabetes policies and plans. I'm so pleased to inform you that we started receiving the newer applications to be placed before the Board of Trustees for the January. And one such application which impressed all of us at the initial stage is the one which is initiated by Dr. Malu and his team. What's important here is what kind of projects can be supported. This is a question often asked by Lions and the leaders, that do we get for this or not? Just to say, Lions Club International Foundation is willing and agreeing to support diabetes camps, retreats, and symposiums. This will help, and we believe, educate and also do screenings. Number two, diabetes screening activities with comprehensive follow-up care. In other words, you do screening, and also we take not only merely ending at the screening, take things a little more forward. The third application that could be diabetes care, infrastructure development, equipment, and acquisition. This is very important that you wish to establish a diabetes clinics or a diabetics care centers, or where you need a medical equipment support. Probably this can also be considered. It's equally important that the Lions Club International finds that is development of human resource training and capacity building. And you have those technicians, or if you have the nearest IDF center or a World Diabetes Federation branch, if you want to work together and you would like to initiate empowering the volunteers with education that's related to diabetes, probably that investment is also supported by Lions Clubs International Foundation. Having said this, I did say earlier that a district can make at least 2 applications in progress, that is in execution. Each of the application of a sub-district should not be more than $150,000. In the event the whole multiple is applying for the multiple grant, then it can go up to $250,000 US. We also support Leo grants, again for the service of the Leos if they are initiating towards the diabetes related activities. If a club initiates that request, he would be given the club would be given $2,500, and if it's a district, it could be up to an amount of $5,000. What's more important is that the application shall not only have the basic requirements of information such as project title, project location, project budget, amounts of funds requested from LCIF, and the duration of the project, and most importantly, the goal of this project, specific project objectives, and number of people who will directly benefit from this project, and most importantly, Lions district, sub-district, or a multiple district submitting the project, and the number of Lions clubs directly participating in the implementation of this project. Collaborating partners, if any, organizations and institutions are welcome, such as Indian Medical Association or Indian Diabetologists Association, or the nearest International Diabetes Federation chapters, or a World Diabetes Foundation chapter. And what's important that we wanted is the contact information of the project chairperson who's going to lead this project, and this application needs to essentially signed by the district governor, duly recommended by a project chair, by the district governor, and also the council chairman. So in other words, the application is essentially required to go through before being officially submitted 90 days prior to the trustees meeting. It had to go through the process of a multiple council and also a district. It may look it is a little too longer, but it's essential. When you call it as a district project, number of clubs are involved. When you call it as a multiple project, number of districts are involved. We would want the district to carefully study the request that is being forwarded to the Board of Trustees. Mark my words, friends, Lions Clubs International Foundation, through its Global Health Initiative Department, is fully willing and ready to support districts and multiples in your endeavor in taking, diabetes, not only a mere care, but a challenge that is so deeply posed in Indian continent. And this is what I have. Should you have any questions at the end of all the presentations, I'm willing to answer those questions. And thank you, Past Director AP. Over to you.
I think that was extremely well initiated, Past Director Vijay Raju, trustee of LCIF, for putting it forward how the foundation is going to be supporting these projects. If Dr. Indurkar is available now and his system is working, could we move back to him? PID AP Singh. I think they
Hello.
are. Dr. Malu, are you
Am
there?
I audible?
There is an echo. You have two systems on and you have a microphone next to you. Your phone is next to you. Please use only one system, Dr. Indurkar.
Okay, okay, sure.
You still have two systems on. Please use only one system.
Yes. You start. Hello, this is Dr. Indurkar. In next 12 to 15 minutes, I will be discussing with you status of diabetes, what is diabetes, and how we are going to make it more comfortable for our country people.
It appears we are having an audio challenge with Dr. Indurkar and Dr. Malu. So what we will do is that we have his presentation and we will talk about the presentation as we move along. And meanwhile, I would request PID Sangeeta to try and contact them through other means to see if they are possible to be brought on. So we know what diabetes is. It's basically
AP,
because
we have another person who is willing to do a presentation or speak about it. If you will see in the those who have joined in attendees, Karan Kakkar, he is willing to speak on this. So if you would unmute him.
Karan Kakkar is unmuted.
Karan, are you there?
Yes, I'm very much there. Am I audible? Perfectly fine.
A little louder.
Yeah.
Sure. I'll be a little louder. Perfectly fine.
Good.
Yeah.
Perfect.
Hello to everyone. And so I'll just very quickly run you through this presentation also if you want, or else I can just speak about what as Lions I would aspire, it to do.
Please speak. Please speak. We are not having options. Please speak on. Please continue your presentation.
Perfect. So I would firstly congratulate Lions International for having touching a subject which has become an epidemic in today's generation. Point number one. Point number two, having said that, we would not want to just do anything for the sake of it. Rather, the aspiration would be to do something so significant that it can have impact on people's life. And in today's generation, talking about managing diabetes is now a history. What we should focus on is on reversing diabetes, right? Point number one. Another, and the only way in which Lions International can help people reverse their diabetes and thereby save them from the complications that would have otherwise come if they have not treated the root cause of the diabetes. The only way to address this is by not another pill, okay? Because a pill for every ill doesn't work in case of lifestyle disease. The only way we can do this is by treating the root cause of the disease. Moving on, we need to understand that with respect to diabetes and lifestyle diseases in general, education is more important than medication, right? So in fact, in today's generation, if we ask 10 people who are having diabetes, if we ask them that were you told that your diabetes can be reversed if you do good lifestyle changes, 9 out of the 10 will tell us no, we were not aware that our insulin injections can be completely stopped, that one day my reports will be non-diabetic. So the first the first intervention should be in terms of creating the right awareness that we did not treat the end symptom of the disease. So for example, diabetes is not a problem of high sugar. High sugar is the end result of diabetes. The root cause is insulin resistance, which was mentioned in the first slide of this presentation, which is there. So insulin resistance is the root cause, and we need to treat that. So first is that a level of awareness that you did not have diabetes when you touch your 60-65, even if you were diagnosed when you're 40-45. So first, I think Lions International should have the right content in terms of creating the right awareness internationally. And there are pioneers, there are pioneers, doctors who are pioneer in the science of medical nutrition, who have proven, for example, to everyone, there's this doctor called Dr. Dean Ornish. Okay, if you just Google that also, information is all out there. He is doctor of Barack Obama. He is a Harvard pass out cardiologist. Okay, that guy in the year 1990 July have proven to the medical science, with the help of quantitative angiography, that how arteries can be clogged and opened up, that 3 months plant-based diet can start reversing heart diseases, right? Proven black and white in one of the most prestigious medical journal called the Lancet. Still in India, every 33 seconds, this 2015 statistics, every 33 seconds, someone dies because of heart attack, for a disease which should not even exist in the first place. Okay, similarly we have data for diabetes. Okay, and last 30 years diabetes in India has shot up like anything. 2017 statistics, 70 million people in India are diabetic, which is around 7 crores. Another 72 million people are pre-diabetes, which is a huge chunk. Now, what I mean, last 30 years, there has been no scarcity of doctors, there's been no scarcity of medicines, there has been no scarcity of hospitals. Then why are the rates doubling? Not even doubling. Why are the rates going multifold? Okay, and I think I mean, medical industry will not address the root cause of it, right? Because they would be treating with medicines. But I think as a group, Lions International is very powerful in terms of addressing and educating people to treat the root cause of the disease and thereby reverse their diabetes. Because imagine if Lions International puts up picture and names of 1000 people whose diabetes they have completely reversed. I think that is remarkable, as a data, and that can be then extrapolated, and we can touch lakhs and millions of life. I hope I'm making sense. Hello?
Karan,
Hello?
please go ahead.
Yeah, perfect.
Yes, Karan,
Yeah,
please go
so
ahead.
perfect. So I think the only way I would really want this to move ahead internationally is in 3 steps. Step number 1 is, let's create the right content and right awareness level, so that all of us are, as members of Lions Club, all of us are in the same page. For example, an example of that content would be, we all know that cornflakes is only sugar, but trust me, 90% of Lions member would not know this, right? So the right content and right level of awareness that diabetes can be reversed with right lifestyle changes. See, if you want to have medicine, please go ahead and take medicine, but it is not about medicine or no medicine. It is about treating the root cause of the disease, right? Which is key in terms of reversing lifestyle diseases. So first step is creating right awareness and content, which can go to Lions International. Second point is that once the right awareness and content is created and spread, we should have right programs at multiple levels, district levels, which can then be monitored and in that same direction. And 3 is, after the awareness and the right programs, the third would be to have measurable outputs. I mean, we just don't want to do activities for the sake of it, but all activities should be ROI driven. So when I say ROI, it is not monetary ROI, but result oriented. So which means that in last 3 months, how many diabetic have been actually been taken care of, reversed or things like that on last 6 months, last 1 year, and these data should be continuously updated and increased, and that impact has to go at a larger scale, right? So these 3 steps is what I think would be a great way to move ahead, and we can keep comparing numbers, keep motivating each districts, and really create a big impact on this space. So this is what I feel.
Thank you so much, Karan. I think that was indeed a very different approach to what we have been talking about. But reversing diabetes is also very important. And Dr. Karan Kakkar, as he is a Lion member, and he has also been organizing programs where he's talking about how you can reverse diabetes. In fact, I think he's at a program in Aurangabad, as he said, and he's having a very big event in Kolkata also, where he is talking about or talking to the audience as to how they can change their lifestyle and make it healthy. So I think Dr. Naval Malu is now available, probably, AP. If he is, can we have him on the line? Dr. Naval Malu.
Yeah, Dr. Indurkar will say a few words in the beginning.
Okay, please go ahead.
Dear Lions, Karan has talked a little bit about diabetes. I would like to add a couple of things. Like he has rightly said that this is a non-communicable disease. Along with diabetes, hypertension, obesity are on the rise in our country. And the challenge would be inadequately dealt only by doctors or their associations. And to deal such a massive or high magnitude tsunami of diabetes, we do require a great help from lions across the globe. And what we would expect is, I think the previous speaker has rightly enumerated some of the additions. In addition to that, I would say that we have a long-term battle against diabetes, and to do this, to manage type 1 diabetes in youngsters, type 2 diabetes in elderly, obese, or all across the age group, we do require early awareness in the society, which has to be done jointly by we people. If awareness is good, probably we'll be able to diagnose the disease at earliest. And if we diagnose the disease at earliest, the likelihood of complications coming in the future would probably reduced, arrested, or even we can prevent the complications. And our war against diabetes, of managing it, making aware to entire fraternity, to treat it at earliest and see that the help of management, awareness, diagnosis, treatment of complication goes across every small town, every small village in our country. And this hurricane task of reaching to the depth of our country would probably very well done when Lions of India and Globe they join hands with a forum of physicians or diabetologists, and we go ahead with an excellent plan which we have been already dealing with our local branch of Lion, and most of the other facilities have been discussed and would be provided. Thank you very much.
Thank you, Dr. Indurkar. And now can we move on to Dr. Malu?
Yeah.
Dr.
My
Malu.
slides,
Yes.
request, yeah.
AP, if you could get Dr. Malu's slides.
We'll do it slowly. It's happening.
Yeah, good evening, everyone. First of all, my compliments to PID AP Singh and PID Sankita ji for this initiative. My thanks to Dr. Sanjeev Indurkar. He's a renowned diabetologist in this region, and we will be working together, Diabetology Association and the Lions, for the work, because we have to have a good team to work throughout the year. Lions Clubs International has given priority for this program, and it's a big epidemic of a disease, and the Lions Clubs International Foundation is very well supporting our program and the diabetes initiative. My humble request to each and every Lions Club, they should participate regarding diabetes, because each and every club, if they come out with a small or a big program, we can take this to a big thing. We can have a diabetes awareness, we can have prevention, we can have good treatment and prevent the complications of this dreadful disease. Awareness programs can be in the form of lectures and in the form of rallies. They can be done as a street plays, or we can send messages through a social media. There is no need of particular week or particular month, but we can have this awareness programs throughout the years as and when the club decides or the district decides or the multiple decides. Next slide. There are two things in this, like early diagnosis or prevention is an important issue. We should target as Lions those people who are having strong family history, either one of the parent or both the parents or some other cousins in the family. Then obesity is becoming a major thing in this era now, and also anyone above the age of 40 years, because everyone has a stressful life. Blood sugars can be done by the clubs, by our clubs, using glucometers, which is very simple thing, not having much cost. Then we can have the routine fasting and post meal sugars. Clubs can do on behalf. They can arrange these things along with the pathologist or some hospitals. And the most important thing is HbA1c, which I'll talk later what we can do about this. Slide. Slide, please. Management of the known diabetics, like we have our own hospitals, or we can join with some other general hospitals or medical colleges, and we can have blood sugar examination camps at various places. We can have at the remote places also, and we can have some education regarding the regular treatment and how we can prevent the complications, and diet and exercise. Next slide. What Lions can have, like I was telling, we can have a permanent diabetes clinics which can be run on a weekly basis or bi-weekly basis, or maybe every day if possible. Or we can have mobile clinics in association with our permanent clinics, or separate mobile clinics attached to some hospitals, because 70% patients in India, in our country, are in the rural area. So we have to focus on the entire population, and we have to see that as per the financial resources, we can give complete diabetic care to the patients. We can have the complete diabetic care clinics, or whatever possible with our financial resources. Next slide, please. One important aspect is a foot care, where we have so many equipment available for the foot care. You must have heard about amputations. People have to sacrifice their lower limbs because of diabetes. So there are so many equipments which are available for the foot care, and the early diagnosis and the complications can be prevented. And Lions Clubs International Foundation definitely will be funding for this also, apart from the diabetic retinopathy treatment, which is already being done in our established Lions hospitals throughout the country. Diabetic care clinics or the complete diabetic care centers we can also have at our Lions General Hospitals, because we have so many Lions General Hospitals throughout the country. So we can have a small clinic or one small wing in these general hospitals, which is focusing only on the diabetes. Most important thing is like partnerships, as my club and our district has sent an application for that, and we need Lions Clubs International Foundation insists that we should have an association with the local diabetes association, diabetologist association, or if a place is small, we can involve the physicians association, or if it is small tehsil place, we can involve the Indian Medical Association also with this, because we need a team of doctors who is working regularly, who will work regularly for this important cause along with the Lions and lionesses, ladies and lionesses and Leos of our organization. Next. Now, what I was telling you, this buzzer word, now the most recent investigation is HbA1c, and this we have to provide. Like I had been to my government medical college of Aurangabad, they don't have this equipment, and this is costing roughly 6 lakhs. So my appeal to all my Lion friends, if we can provide this to the government hospitals where there are a number of patients and there are really needy patients. This test is very important, and if it is done, we can have very early pre-diabetic diagnosis, and we can prevent patients having patients who will get into diabetes or will be getting into a lot of complications. So best thing which we can do is HbA1c test for the maximum population of our country. Next slide, please. So let's pledge for the prevention of diagnosis and a cheerful life for all the diagnosed diabetic patients. Thank you very much.
Thank you, Dr. Malu. Those were the 3 presentations that we had, and an additional one, Dr. Karan Kakkar. So that gives us an overview of what we can do, what Lions can do, and most importantly, what the foundation is willing to do to help us in this cause. May I request PID AP Singh to now take over for the question and answer session. And those who wish to ask a question, please, there is a hand icon on your panel. Please press on that and your hand will be raised up. And if you have a question or a suggestion or an idea, please do raise your hand. You will be unmuted and you can ask your question or give your suggestion. So those who have anything to say, please raise your hand on your screens. And I would request PID AP Singh to please conduct this question and answer session.
So now it's open to the participants, and feel free to ask any questions that you want, because you have a panel here of individuals who are medically most qualified to answer the technical parts. You have experienced Lion leaders, a director in office, and an LCIF trustee in office here on this panel with us. So feel free to ask questions. And till somebody else makes up their mind to ask a question, I have a question for, especially for Dr. Malu. Dr. Malu, when we talk of activities of the Lions clubs relating to the diabetic control program or the program of diabetes with Lions Clubs International, what should be the real approach? Is it just about going and organizing diabetes detection camps, and that by itself is an activity? So a club does that once in a year, leaves it, and maybe next year again goes and again organizes, say, 1 or 2 diabetes detection camps. Would that be the appropriate way of doing it? Or is there a more composite and comprehensive way? So you have the qualifications as a doctor and as a Lion leader. Can you tell us what should be, according to you, the way for the clubs to move forward?
As I've told you that we should have a complete diabetes care center. Now we have finance is required for everything, but fortunately we have about 150 grants for our country. So if 4 of 2, 3, 4, 5 clubs join and start with one project, so that will solve the purpose, because we don't want to do just diagnose and leave the patients like that. So we should try to establish more and more complete diabetic care centers, and we should see how best we can do. We can have regular checkups, and we can have definitely an educative programs from the doctors and regular monitoring of the patients with these diabetic clinics, as I have told you. And the clubs which can't participate, they can have some awareness sort of programs throughout the years here and there. But basically we want to have complete diabetic care centers where every aspect of diabetes is taken care of. So definitely we should take advantage of this. My request to all clubs and districts, we should go for this type of centers and we should apply for the grants to the LCIF.
Okay. So meanwhile, there is one individual who's put up the hand to ask a question, Manmohan Sopti. I am unmuting Manmohan Sopti. You can go ahead and ask your question.
Yes, thank you very much. I really like this presentation, and this is a very important area for India, which I feel. I am actually I belong to the membership of Delhi Capital Lions Club, and I would like very much initiate my club to participate in this program, and this is I feel is a very important program for the Indians, as the number of Indians suffering from diabetes is increasing. So I would like that the source from where we can contact for more information about the programs which are being there, that can be distributed to all concerned. It will be a great help, so that in the case of any difficulty, the units can be contacted for running these programs.
So that is a request for a more detailed and a seamless way of passing on information as and when the clubs may need. Any response from you, PID Raju?
Yeah, Pastor Director AP, we should be able to get you the total text of what is possible for a club and what is possible for LCIF. So this can be sent to you, or it can be circulated, or you can write to me, which I can share with them. And probably this entire thing can be uploaded onto Eastern India Leadership Academy's regular PPT presentation, which I'll be able to support. But before I say, I would like to tell two things, and they must at least know what kind of eligible projects. If I am to say in 4 sentences, diabetes camps, retreats, and symposiums. This is one block we can support. 2, diabetes screening activities with comprehensive follow-up care. You conduct a camp, you want to give a support medicines, create an insulin bank, etc., which I have seen that is possible. 3rd, diabetics care infrastructure. That's what Dr. Malu was saying, create an infrastructure. 75 districts, he mean to say 2 grants, about 150 into 150,000, probably that is what he was meaning, and if I've understood him right. So diabetes infrastructure development and equipment acquisition, yes, this is possible, we can give. 4th is human resource training and capacity building. Like there's any club that we wanted to look at it, but the projects are not supported to individual club. There has to be a minimum of 2 Lions clubs involvement, and there has to be a possible beneficiaries. Now, we do not support already the projects underway or the projects more or less completed and asking for a reimbursement. These things are known to everyone. LCF do not support those things. So these are all eligible projects, and I am always there, and directors are available. Our Delhi office can be contacted, who will be able to provide this information. Otherwise, Eastern India Leadership Academy can always support these answers. If there is specific, I can. There were questions to me directly asking, can there be a scientific and clinical research supported? LCF says simply no. So startup initiatives, no. Establishment of new patient care facilities, just because we want to start a new care facility, that's exactly where Dr. Malu was telling, join your hands with an existing setup or create a relationship with the medical fraternity in the place where they wanted to start. And we do not support buying land, buying building infrastructure. Yes, diabetes grants don't support. We will not be able to give those technicians and specialists to travel. We will not be able to support that as well. So these are all in general that I could provide you. And an individual assistance, if somebody is really in need, we will not be able to support the individuals. That's another challenge. Many applications are coming that so-and-so is direly in need, who need this kind of support. Why don't you support? I think LCF does not work on those lines. So this is what at this moment I have from my end to answer him, sir.
I have a question. We have so many eye hospitals in India, and this question came up at the Sight First conclave as well. Not many hospitals are ready for the diabetic retinopathy. So, is LCIF thinking of supporting the expansion of activities of the existing Sight First hospitals run by the Lions clubs in this country for diabetic retinopathy programs? So that would be serving both the needs, the need from a Sight First angle and the need from a diabetic care angle as well. Well, anybody, maybe Dr. Malu or Vijay Raju, PID Vijay Raju, anybody could answer this question.
I'm answering. Past Director AP, your question is very pertinent, and the answer is simply yes. Lions Clubs International Foundation is coming forward to support all the Lions Eye hospitals that are owned and run by Lions for furthering the initiatives towards any diabetes related, such as diabetic retinopathy or any other activity that they intend to do it. They will be considered and supported, and this is independent from the Sight First grants.
A question for which has come in for ID Naval Malu, and the question is: if a district wants to take up a large project of bringing a lot of awareness at the school levels, so can they apply for a grant under the diabetes special grant program just for an awareness program at a very large level, maybe covering 100,000 or 200,000 students for the awareness level regarding diabetes? Would that be covered, since you have been working with the applications for the diabetes programs?
Yeah, LCIF has given 4 aspects. Awareness is one of the aspects, but if it is of a such huge scale, I think that application can be sent, and that can be a very good program also. Like masters, we are covering some population in a large number, so that can be applied for the grant also. Maybe Vijay Raju can comment on this also.
Director Malu and Past Director AP, yes, it is possible as of today based on the application criteria, but then they would certainly examine 100,000 people to be made aware and what kind of a methodology. Those things can always be looked at it, and it is possible. My answer would be yes.
Yes.
The next question that has come to us is like this, and that's that Dr. Malu himself made a request in his last slide about to the Lions clubs to support the government hospitals by providing them with the equipment with which they could do the tests. He said that's the HAB1C test. Now, if that is to be done, and if the clubs are to provide that equipment, and say if they cover clubs, hospitals in a state, and they provide those equipment to 30 or 40 hospitals, then for that particular equipment providing with some kind of Lions participation, would LCIF also support that project?
Director, it's possible.
Because when the question came to me, I wasn't sure of the answer. So if you're very sure, tell us, or you can seek some kind of a feedback maybe from LCIF, and then we could, let our friends know. But if you have an answer, please go ahead and provide us.
No, I think it's a very pertinent particular question that I would be able to soon revert back. Post Thanksgiving vacation we can, but to my mind it is yes. To my mind it is yes.
That we have LCIF mini grants also, Vijayji.
Anji, that is for the Leo.
That is in apart from the 2 grants, or how it is? Mini grants, how many you are giving to each district, or how it is? Like
it is again two per each district.
Okay.
Mini grants, LCIF mini grants.
Yes. It is
mini grants. If we can buy this equipment in the mini grants.
No, it's like
$10,000 mini grants you are giving international.
Yes, that's what.
$10,000 mini grant is there. In that we can purchase this equipment, I think.
That's true. That is true.
Yeah.
Yes, PID Sangeeta.
Yes, I think we have a good variety of questions, a lot of excitement, I'm sure. And as the days go by, I'm sure we're going to see much more application by the Lions in these programs. I do know and understand that this may be at this trustees meeting, we will not have that many applications, but as the word spreads, as people know, I'm sure it's going to increase. So if there are no other comments from our panelists, they would like to add anything. Don't you see any other questions, AP?
No, there was some who sent the written questions. They were having some audio issues, and those are the questions I asked. So,
Okay.
and those were the 3 questions that came in. And because they had the audio issue, they sent it to me. So I put up their questions. And there are no other questions as such coming up now.
So that's, I think, wonderful. And with this, since we have no other questions and since our panelists have explained things so well, probably let us give time to our attendees to mull over it, think about it, and feel free to write to the Eastern India Leadership Academy or any of the panelists directly. I'm sure you know our directors and past directors for any assistance that you may need. We are going to be having a recording of this webinar available on the Eastern India Leadership Academy website in a couple of days. So you can spread the word, share it with the other Lion members in your area, and even probably share it with your district governors, council chairs, so that they can get more information, especially the LCR chairs, get more information about this new initiative brought out by our foundation. We also have many other resources on our website, as we said, and our next webinar is slated for the 12th of December, where we are going to have a discussion about some training activities, leadership training activities for building teams. Our expert panel of Lion leaders from around the globe will be speaking to us, sharing their ideas, talking to us about various training programs that they have conducted and activities that they have used. So do not forget to please register for this webinar on the 12th of December and look out for future webinars. And if you have a suggestion for any topic that you would like to hear discussed on this platform, you feel free to send that to us too, and we will see how we can accommodate that. With this, I would like to thank our panelists, Dr. Indurkar, Dr. Nawal Malu, past director Vijay Raju, and Karan Kakkar, and of course PID AP Singh for hosting this webinar. Thank you very much. Till we meet again on the 12th of December for the next webinar in this series brought to you by Eastern India Lions Leadership Academy. Thank you very much.
Thank you very
and
much.
have a
Thank you.
wonderful
Thank
evening.
you. Thank you.
Thank
Thank you.